this week's segment of HealthAlliance You, we're at Belleayre Ski Center to talk about how winter sports safety can protect you from traumatic brain injury. Here to speak with me is Dr. Paul Llobet, Medical Director at Margaretville Hospital, and Dr. Holly Llobet, Medical Advisor at Belleayre, as well as Medical Director for Intensive Care at HealthAlliance Hospital. In the Hudson Valley, snowmobiling, skiing, and snowboarding are all great activities to get people outside in the winter for exercise and fun. But accidents can happen when participants encounter unpredictable terrain or changing weather conditions. Dr. Llobet, thank you for joining us here today.
Thank you for having us.
So what can we do to help folks who are participating in winter sports stay safe?
One of the most important things is preparation. From preparation, I mean equipment, from clothing to protective gear, notifying individuals where you're going to be participating in these activities, and just staying well hydrated, well rested, and obviously prevent from any type of intoxicating substances, alcohol, which will impair your judgment. When I talk about equipment, I mean proper helmets, proper ski gear or snowmobiling gear. When I talk about clothing, proper gloves, sweaters, jackets, and understand what the environment and what the conditions are so you're properly prepared.
Great. So when we talk about an appropriate helmet, what is an appropriate helmet for snowmobiling or skiing? Can I just use my bike helmet, or do I need a specific helmet for skiing and snowmobiling?
Well, for helmets here we have an example of one. This is more for a skier's helmet. Skiing, or it can also kind of be similar to a skateboarding helmet. But the most important thing is that it fits properly. So you want it snug on your head, that it doesn't move too much, because helmets that are loose can lean forward and obstruct your vision, and helmets that can also go backwards and obviously not protect the front.
Okay.
Secondly is you want to make sure that the strap is nice and snug to your head, and that way it prevents any type of movement. One key thing that you want to do is sometimes try to insert a finger on the side, and if you can insert it freely, it's going to be too loose. Other important thing about helmets is that it's only able to sustain one direct hit. So if you've already had a helmet accident, or hitting against a tree, the ice, that helmet has already been lost its use and lost its safety, so you need to replace the helmet. Secondly, helmets have a shelf life of about 7 years. So if you've had a helmet over 7 years, you'd want to get a new helmet and kind of update your safety gear.
All right, so we know the proper gear can help prevent a traumatic brain injury, but what is a traumatic brain injury? What are some of the problems it can cause?
So a traumatic brain injury, otherwise called a TBI, can result from a blow or a jolt to the head. There are different levels of TBIs. They can range from mild all the way to severe and life-threatening. Most brain injuries, 75%, are mild in nature, called a concussion, and most people will recover in several days from a concussion. Some of the symptoms you want to look for in a TBI after having a blow to the head would be a headache, dizziness, seizures, nausea, vomiting, unsteadiness on the feet, as well as brief loss of consciousness.
So do we know, are there specific people that are more at risk for getting a concussion?
So children and young adults, as well as the elderly, are at highest risk for a concussion. Mainly because their brains are smaller, so they've got more room to move inside the skull.
All right, so what should folks do if they get a head injury?
If you're here at Belleayre Ski Resort, you should flag down the ski patrol. You can find them all over the mountain. They'll be able to help you get to the bottom of the mountain, do an evaluation, and make some recommendations. If you're out in the wilderness or anywhere else, you should seek medical help and go to Margaretville Hospital. And they'll have a professional be able to evaluate you and advise you.
That's great. I was pretty impressed with this facility here in terms of the infirmary. Dr. Paul, what can somebody expect if they go to see a medical professional with suspecting that they may have a head injury?
Well, I'm glad you noticed the Belleayre. They spend a lot of time in preparation with the ski patrol for training and having the ski patrol understand what traumatic brain injury is. What people should expect is, after having a full assessment here at the Belleayre Mountain, they're most likely going to be transferred to Margaretville Hospital. There from Margaretville Hospital, we have a fully staffed emergency room with an on-call physician 24/7. And the beauty about Margaretville Hospital is it's got a top-notch CT scanner which can really give us detailed information as to the severity of the injury. This is including from life-threatening bleeds to just mild concussions, and the provider there can decide whether this needs to be escalated to a higher level of care. And we have Albany Medical Centers for level 1 traumas, and then we have our affiliate hospitals, which is the HealthAlliance, which we would transfer patients over there to Kingston City.
So what can a patient do to feel better once they have a concussion?
Main thing for concussion is hydration. The thing many people forget is, oh, I just had a small fall, it's not a big deal, let me just go home. Those tend to be just as deadly as the severe injuries that would require the attention right on the mountain. Hydration is important. If you start feeling any type of dizziness, any type of confusion, increased lethargy, that's the time when you really need to seek medical attention, because those could be the complicating, life-threatening injuries. It's always recommended to notify someone to at least have a clean set of eyes set on you to see if you're acting inappropriately. Then those individuals need to go to the emergency room as well.
Can you explain what lethargy is?
Lethargy is just going to be just tired. One of the biggest mistakes is, oh, I'm tired, let me just go to bed.
Okay.
You go to bed and then you don't realize that...
I often feel that way.
Yeah, after a long day of work, right? But on the mountain, you're always refreshed coming down. But when you're starting to feel a little bit tired, you go to bed, and those can be the window where the traumatic brain injury leads to a life-threatening bleed. So you really need to be observed, whether it be at the ski patrol station or whether it be in the emergency room.
So outside of skiing, what are some other gear that we need to be conscious of, or other safety precautions for winter sports?
Well, all activities require a particular type of helmet, regardless whether it's a winter sport or a summer sport. But aside from skiing, we also have snowmobiling, ice skating. All of these activities can have the same type of impact or blow to the head. When it comes to snowmobiling, you should contact Department of Transportation to make sure that you have the appropriate helmet. They are a little bit more protected and padded than ski helmets. Ice skating would probably be somewhat similar to a skiing helmet. And then you have all the other type of sports that would probably be more particular to the type of activities that you're doing. And that you would just find either a professional or a sporting department that could advise you properly.
Great. Well, thank you, Dr. Paul and Holly Llobet, for joining us today. We really appreciate it.
Thank you for having us.
We hope you found this segment helpful in answering your questions about winter sports safety. Remember, if you injure your head and think you're experiencing symptoms of a concussion, see a physician immediately. That's all the time we have for today. To get more health information or to view this episode again, visit hahv.org. For HealthAlliance You, I'm Josh Ratner. See you next time.